How do you stop the idea of, if I go to a psychiatrist, I'm crazy, and everyone will know, and it's the stigma associated with it? Or if a parent knows that they have a teenager that is vulnerable or talking about it, what do people do? And then I want to talk a little bit about the intake process. If somebody gets into a psychiatrist, what can they expect? And you can talk about your own practice or in general, but I know those are many questions, but I just think through families, like, we're so scared to take action for fear of what people are going to think.
Well, there are a variety of reasons, and this is sometimes a source of frustration. So one area that's positive in last 40 years that I've seen a change, 35 years, is schools are being very sensitive to this issue, and kids don't mind telling somebody that so-and-so is thinking of suicide. And the school counselors have often done a fantastic job of identifying a problem and making parents aware of what's going on. So that's one positive. So where do you reach out? And this becomes a challenge. And city to city and county to county in Texas, what the law will do is extremely unpredictable and often unprofessional. So I've had situations where the patient's in the ER and person from the law that came to see them would say, well, he had a gun, but I didn't see him actually putting it in his mouth, so I can't commit him. That's how crazy it's gotten at times. Other side is that certain local police departments are very sensitive, and if there is any doubt in their mind, they'll take the person for an assessment and hold them for a period of time. Now, for people who are having problems that require any kind of psychiatric, mental health related help, the resources are there. If nothing else, start with your clergy. I know some excellent ministers that are very astute at recognizing the need for help and motivating the family to create that help. But what happens is often the person that's trying to help has limited resources, and they're exhausted by the time this situation it keeps deteriorating. So you have a family member that's non-functional, has been a problem for a long time in your life, and at some point you say, I can't. Last time, 2 times or 3 times I took them for some kind of an assessment, nothing happened. The hospital stays have shortened because of the way our system is. And people don't have the resources. So I would say anything from finding a therapist, interventionist, and if they don't go, you go. One of the things I tell patients sometimes is, if you're having a problem with one of your family members, you can tell them that I've gone to see a psychiatrist, and it's basically because I'm struggling with what you're doing, and I'm trying to get some help. Now, often that will lead the future patient to say, well, there's nothing wrong with me. Maybe I can go talk to the doctor. And then they do come, or they'll go somewhere else for help. But letting the other person know that you're so disturbed by what they're doing is that you're seeking some help for yourself, because this is driving you to insanity. But sitting aside passively does not work. And even with all the efforts, services are limited, and often people don't get the help they need.
I agree with you.